Oh, I just started. Okay. Hi, my name is Matt, and this is Maggie here, and today we're going to do the actually abdominal assessment. So first thing we're going to do is provide privacy for the patient, wash our hands, we have good lighting. And so first thing we're going to do is inspect the abdomen. And we're actually looking at the symmetry, the skin, the characteristics of the abdomen. We want to make sure it's bilaterally equal. Look for any discoloration, any pulsations. No, I'm sorry, you can keep it down. Next thing we're going to do is actually we're going to listen to all 4 areas of the abdomen. And we're going to listen for 5 minutes into each area. And if we do not hear bowel sounds after 5 minutes, then we're going to say that their bowel sounds are absent. So we go 5 minutes in each area, all 4 quadrants. Then the next thing we're going to do is actually percuss each area. And when we percuss each area, we're going to have the fingers at an angle. And we're going to tap, and we're going to actually listen for any dullness or any thuds or anything that sounds different than what it should normally sound like. Next, we're going to actually palpate each area. And we're going to firstly start out light, with just like our fingertips light. And as we do this, we're going to be looking at the patient, noticing if they're grimacing or having any pain. And we're doing all 4 areas. Basically, that's what we're going to do is to inspect and see if they're having any pain. Next to, we're going to palpate deep, and we're going to use both of our hands, and we're actually going to go deep into the abdomen, and we go deep here under the right side to the liver. Actually, if we were going to do the liver, really technically, we'd hook around the back and push in deep with our hand to see if we could feel it. We should not be able to feel the liver, but that's what we would do. And we palpate here too to feel the spleen kind of the same way, 2 hands really deep. And as we're going deep into all 4 quadrants, we're looking at the patient and noticing if they're grimacing or wincing or having any pain at all. Sometimes they may tell you that they're not, but you see them grimace, so we're actually going to look at them very closely when we do that. So now you want to sit up for a second. And now we're going to percuss the CVA, or actually check out the kidney. So what we would do is take our hand and kind of hook it on this back flank part, and we're going to actually hammer fist this part. And then we're going to have the patient tell us if they have any pain.
No.
Any pain? No?
No.
And then we do the same thing to this side.
Nope.
No? Okay. So that's our way to check for pain on the CVA. So basically, now I'm going to actually talk about testicular and breast exam. So basically, to start out with the breast exam, I'm just going to read straight from the book. After palpating all 4 quadrants of the breast, we're going to palpate the nipple. Notice any induration or subareola mass, and with our thumb and forefinger, we're going to gently press downward on the nipple and well behind into the areola. The tissue should move inward easily. If the woman reports spontaneous nipple discharge, we're going to press the areola inward with the index finger and repeat a few different directions. If the discharge appears, we're going to notice the color and consistency. For the woman with large breasts, we're actually going to palpate by using the bimanual technique. And when the woman is in the sitting position, we'll actually have her lean forward, support the inferior part of the breast with one hand, use the other hand to palpate the best supporting hand. And what we're going to do is, and then we're going to notice, if we do have some sort of mass, we're going to notice the location, size, shape, consistency of the mass. Is it movable? Does the nipple displace or retract? And then we're going to note the skin over the lump. And then is it tender around the lump? And also, if we find anything like that, they're just basically going to have to go to their doctor. Next, we're going to check out for a testicular exam. When would you do a testicular exam? Timing would be once a month right after a shower. We're going to examine and check and report basically just for changes. We encourage self-care from every male on how to examine his own testiculars at least once a month. So we're going to gently examine the testicles during during the shower or bath with the hands, and use a warm, soapy, make sure the scrotum's warm. Cold hands will stimulate a muscle reflex retracting the scrotum. This procedure is simple. Holding the scrotum in the palm of your hand, gently feel each testicle using your thumb and 2 fingers. If it hurts while you're using too much pressure, the testicle is egg-shaped and movable. It adheres readily with a smooth surface like a peeled hand, hard-boiled egg. Love that description. The epidermis is on top and behind the testicle. It feels a little bit softer. If you ever notice any firm or painful lump or hardened area over our large testicle, call your physician for a further check. So that's what you need to do. Okay, and this concludes today our abdomen assessment, our breast exam, and our testicular exam. Thank you.